Hello everyone. Today we'll be talking about enteric fever, which we commonly refer to as typhoid fever. So the causative organism that leads to enteric fever is Salmonella Typhi and Salmonella Paratyphi, the serotypes A, B, and C. And Salmonella are gram-negative bacilli. Mode of transmission. So humans are the only reservoir of Salmonella typhi. Thus, this direct or indirect contact with an infected person is necessary for infection. So please take note, Salmonella typhi, humans are the only reservoirs, okay? Ingestion of food or water contaminated with human feces is the commonest mode of transmission. Congenital and intrapartum transmission can also occur from a bacteremic and chronic carrier mother. And sexual transmission from an asymptomatic carrier can also occur. So basically, the most common mode of transmission is by ingestion of food or water that is contaminated with human feces, okay? However, we can also have congenital and intrapartum transmission, okay? So how does this occur? It can occur from a bacteremic and chronic carrier mother, okay? So incubation period is 7 to 14 days. This is the most common. However, it can be as long as 3 to 30 days or sometimes even 3 to 60 days, okay? Period of communicability is from the first week to convalescence, which can last up to 3 months or even 1 year. Susceptibility is reported in preschool children and 5 to 19 years old in endemic areas. And it's also common in those with impaired cellular immunity, sickle cell disease patients, elderly, debilitated, poor sanitary conditions, poor water sanitation, gastric achlorrhea, HIV positive. So you might be wondering why gastric achlorrhea is one of the susceptibility causes. So it's because in achlorrhea there's reduced levels of acid, okay, in the stomach, due to which Salmonella is able to thrive better. Pathogenesis is transmitted by the fecal-oral route from cases or carriers. Bacteria proliferate in pairs, patches, and small intestine, which is followed by primary bacteremia. And it's distributed to the radicular endothelial system organs. So we're going to talk about the pathophysiology in more details. So this is characterized by hyperplasia of the reticular endothelial system with proliferation of the mononuclear cells. This occurs in the pairs patches where infection enters the GIT form. So basically you are going to ingest it, it's going to go down the stomach and then into the intestines, okay? So it involves the mucosa and the lymphatic tissue of the intestinal tract, causing severe inflammation and necrosis, inflammation of the intestines, and it can penetrate the deeper tissues to cause perforation. Liver, spleen, mesenteric nodes are hyperplastic with focal areas of necrosis. Inflammation can also occur in the bone marrow, gallbladder, meninges, lungs, kidneys, eyes, joints, bones, causing meningitis, pneumonia, bronchitis, pyelonephritis, nephrotic syndrome, endophthalmitis, optic neuritis, arthritis, osteomyelitis as complications. So basically, enteric fever, it can complicate into any of these, okay? Any of this condition we just talked about. So let's just look at it as a flow diagram, okay? So once you ingest contaminated food, you ingest the ingested bacilli, they invade the small intestinal mucosa, which is taken up by macrophages and transported to regional lymph nodes. Salmonella typhi multiply in the intestinal lymphoid tissue. They interact with enterocytes and M cells that are present in the ileal pairs patches during the 1 to 3 weeks of the incubation period. This is where you present with diarrhea, okay? Then once this is the end of the incubation period, bacilli enter the bloodstream, and that is the bacteremia phase. This is where you get your onset of typhoid fever. That's where the fever will come in. Then bacteria invade the gallbladder, biliary system, and lymphatic tissue of the bowel, and they multiply in a high number. They then pass into the intestinal tract, which is the stool, okay? So basically, that was a summary of the pathophysiology. So clinical picture. So it's going to be divided into 3. So the first stage is going to be the prodromal phase, which is the first week. Then in the second week, that's where fever becomes high and there's tachycardia. Then the third week, that's where there is a gradual improvement, okay? So under the prodromal phase, which is the first week, there is an insidious onset of headache, prostration, anorexia, and fever. And one thing you need to take note is typhoid has a characteristic step ladder pattern of fever, okay? So fever will rise slowly, okay? So maybe if today it's 98 degrees Fahrenheit, tomorrow it will be 98.5, the other day 99, so it will rise in a step ladder fashion, okay? Then there will be a quartet turn. You may also get relative bradycardia, diffuse abdominal pain. Then a piece of diarrhea may occur early, but constipation predominates later. So in the early phases, you're going to present with the diarrhea. Remember we looked at the pathophysiology? Yeah, so in the early phase, you'll present with the diarrhea, but later you'll get constipation, okay? Then there's also present a frost spot. So what are these? There's an erythematous maculopapular rash on the lower chest and abdomen. This appears in 25% of patients by the end of first week, and it lasts for 2 to 3 days, and it leaves a slight brownish discoloration on healing. In the second week, fever becomes high and continuous. Patient appears acutely ill, disoriented, and lethargic. Then there's tachycardia due to myocarditis, with diffuse abdominal pain with splenomegaly, and there will also be hepatomegaly. Then in the third week, you get gradual improvement of general condition and decline of fever with appropriate treatment. However, if you do not do anything about it, you may get complications. So what are the complications? Let's look at it in a systematic way. Let's start with neurologic. So under neurologic, you may get encephalopathy, cerebral edema, Guillain-Barré syndrome. Under cardiac, you may get a pancreatitis and heart failure. Under pulmonary pneumonia, empyema. Under gastrointestinal system, you may get intestinal perforation, which was made very clear with our pathophysiology, intestinal hemorrhage, cholecystitis, hepatitis, splenic abscess. Under renal, you can get pyelonephritis, cystitis, a possible carrier state. Then other conditions is osteomyelitis, septic arthritis. So investigations, what investigations would you do on a patient that you're suspecting has typhoid fever or enteric fever? So you always have to do a complete blood count, okay? You check for anemia and leukopenia because there's toxic depression of the bone marrow. Then one thing you need to take note is, let me just give it to you as a summary. So you do a culture, okay? So culture of what? So you do a blood culture in the first week, urine culture in the second week, and stool culture in the third week. That is after onset of symptoms, okay? So in the first week, if you do a blood culture, it's positive in 40 to 60% of cases. Then in the second week onwards, positive stool culture, positive Widal test, detect antibodies against the O and H antigen. So Salmonella has got O and H antigen. This is what is detected by the Widal test, okay? So they detect antibodies against O and H antigens, and it's never used alone to prove diagnosis. Then in the third week, you do urine culture. Recent investigations, amplification of Salmonella Typhi specific antigens using PCR, detect S Typhi specific antigens using monoclonal antibodies, and culture of bone marrow cells that's not affected by prior use of antibiotic. So treatment. So for a patient that's a positive case, okay? So you do bed rest and a light diet, symptomatic treatment, and treatment of complications. Then antibiotics. So one thing you need to take note is antibiotics. So for the antibiotics, you need to ensure you look at the sensitivity pattern, okay, in your region. However, we're just going to give a summary here with the dosage and duration, okay? So if they're fully sensitive, so you can use chloramphenicol or amoxicillin. So chloramphenicol, the dose would be 50 milligrams per kg and duration would be 14 days. Amoxicillin, it's 100 milligrams per kg for duration of 14 days. Then if they're multi-drug resistant organisms, you can use a fluoroquinolone, that is 15 milligrams per kg for 7 days, or you can use cefixime, which is a cephalosporin, right? So those would be 15 milligrams per kg for 14 days. Then if they're quinolone resistant, you can use ceftriaxone, 75 milligrams per kg for 7 to 14 days, or azithromycin for 10 milligrams per kg for 14 days. So in our region, the drug that we use is ciprofloxacin for 7 to 10 days. So we use 750 milligrams twice a day for 28 days, or norfloxacin 400 milligrams twice a day. That is, it has been reported to treat carriers in 80 to 90% of cases. So basically for treatment, we use ciprofloxacin, and norfloxacin is used to treat carriers, okay? So how can you prevent enteric fever? So basically you need to have food and water hygiene. And there's also a vaccine, TY21A, and a V1 capsular conjugate vaccine. So prognosis with early antibiotic therapy, mortality is less than 1%, and relapse occurs 1 to 3 weeks later in 10 to 20% despite appropriate antibiotics. So that's all about typhoid fever. If you like the video, please like, subscribe, and comment. Thank you.